In recent years, the deaths of actors Christy Alley and Chadwick Boseman have put a new national spotlight on colorectal cancer. It is Colorectal Cancer Awareness Month. Today I have Dr. Liana Sakitas, with Fellow of the American College of Surgeons. Good morning, Doctor. How are you?
Good morning. I'm well. Thank you for having me.
Well, thank you for joining us. So, what is colorectal cancer and who is most at risk of developing it?
So, colorectal cancer is growth tumors within the large intestine. The average risk for colorectal cancer for anyone, any of us, is about 6% in a lifetime. However, there are certain persons that are more genetically predisposed to colorectal cancer because they have family history or a genetic syndrome. And we are finding also that we see a significant rise in the young, in early onset. We see early onset colorectal cancer, and we're not sure why that association, where that's coming from. But definitely colorectal cancer, we're seeing it in the rise on the young.
So, Doctor, what are some of the most common signs and symptoms of colorectal cancer?
That's a great question because colorectal cancer at the early stages it doesn't really cause symptoms. In more advanced stages, we start seeing changes in the bowel habits, rectal bleeding, unintentional weight loss, and abdominal pain. Those symptoms will be persistent over periods of time, and they need to be, the primary care provider needs to be alerted so they can be a workup.
Now, who should get screened for colorectal cancer?
So we start colorectal cancer screening at age 45. This is the most recent guideline that came out from the U.S. Preventive Task Forces. And we start at 45 so we can cut it early and the young patients, the young subjects. If the colonoscopy, if the endoscopy is normal, meaning we don't find any polyps or growth, then it's every 10 years. If one person has a family history of colorectal cancer, then they need to get their screening, first degree relative, they need to get their screening 10 years prior to when their family member was diagnosed.
Wow. Now, what screening options are available for colorectal cancer?
So we have stool tests. The one test that is very frequently used is the FIT test that tests the hemoglobin, the blood count in a way in the stool of the person. There is also the test that tests the DNA, if there's a tumor, like the tumor cells within the stool and the hemoglobin. And then we have endoscopic tests. We have the flexible sigmoidoscopy that only examines part of the large intestine all the way up to the left side of the large intestine. And then colonoscopy, which is the gold standard, examines the whole colon.
Wow. Now, what advice would you give to someone who was reluctant to get screened for colorectal cancer?
What a great question. As a physician, I feel it's my duty to find out why they're reluctant. What is the fear about getting the screening? It's one of the few cancers I tell my patients that when it caught early, you can be completely cured. And particularly when you can catch it even before it becomes a cancer with polyps. So when they're reluctant, I'm trying always to delineate why they are reluctant about getting the screening. There are multiple ways you can make the preparation for the colonoscopy easier on the patient. We have multiple different preps on the market that we can help. But again, delineating where the fear emanates, it may give us an opportunity to get the patient towards the test.
Two questions. The last one's, at what age should someone start getting the test, and where can we go for more information?
Screening guidelines for persons without family history starts at 45. More information you can one can get it from their primary care provider. If they don't have a primary care provider, just even, as I say, Mrs. or Mr. Google, however you want to, you can examine from the American College of Surgeons. You can even say screening for colorectal cancer, and multiple guidelines will come up either through the CDC, the American College of Surgeons, and many other professional societies. So that it will guide you.
Mr. and Mrs. Google, I like that. Dr. Sakidas, thank you so much for joining us on Morning Blend. It's Colorectal Cancer Awareness Month. Thank you again.
Thank you. Thank you for having me.